Hello, I'm Dr. Debapriya Mondal. I'm a medical oncologist. I'm going to tell you about the newer advances which have completely transformed the way we treated lung cancer. Now, when a lung cancer is in advanced stage, that is either stage 3B or 4, we used to have very limited options of treatment, and it used to be mainly chemotherapy. With chemotherapy, the survival was not good, and the side effects limited the utility of chemotherapy in only a few fit patients. So, chemotherapy was not for everyone, and chemotherapy did not help most of the patients. In early 2000s, we move on to something new, that is precision treatment or targeted treatment. The first gene that was discovered and against which a targeted therapy was introduced was the EGFR gene. And the first targeted therapy was gefitinib. With the advent of gefitinib, something completely changed. We now started treating lung cancer with oral tablets, and subsequently, many more targets were discovered. Now, the understanding is that there are certain genetic alterations which make these cancers addicted to those genetic alterations. And those are the reasons why the cancers grow. Those are the reasons why these cancers metastasize to other organs and travels all over the body. So if we can target those specific genes, if we can hit those genes with specific targeted medicines, then we can also control the cancer very successfully. The examples are EGFR, ALK, ROS1, HER2, MET. So there are many such genetic alterations which we can target with specific drug in a very precise manner in today's time. So we have now certain advanced generation targeted therapies, like we have third generation EGFR targeting therapies, we have third generation ALK targeted therapies, which can also go inside the brain of a cancer patient and kill cancers inside the brain. Now, this is very important because about 1 in 4 lung cancer patients will have brain metastasis, and that is where our conventional drugs cannot enter, but new generation drugs can enter and control the cancer even inside brain. Now, what are the other options? It is not just targeted therapy, we also have immunotherapy now. Immunotherapy is for patients who are not candidates for targeted therapy. That means who do not have such genes which make the cancer addicted. We also have another test called PDL1. PDL1 positivity gives us an idea which patients are expected to do better with immunotherapy. What is immunotherapy? How does immunotherapy help patients living with lung cancer? Immunotherapy is basically a treatment which unleashes our own immune system's power in detecting and eliminating cancer. So, in other way, I can tell you our immune system in its natural state cannot detect or clear cancer cells. But when a person is receiving immunotherapy, the very immune system, our own T cells, they can attack and kill cancer cells. What are the chances of benefiting from immunotherapy? Like I said, the PDL1 score is one way to look at it. But if I am to say about a broad population, say about 100 patients are started on immunotherapy, then we can expect that 25 to 30, that is 25 to 30% of them are expected to do well, and they are the ones who live beyond 5 years. So, lung cancer in stage 4, the survival was only 1 to 5%, less than 5%, very poor survival not long ago. It's about 15 years ago when we used to say that there is no treatment option for stage 4 lung cancer. But in today's time, we can tell our patients that some of them will live a relatively healthy and long life even with a stage 4 lung cancer. So it is very important that whenever a patient comes to us, we test the patient appropriately. We test them with the appropriate molecular test so that we can detect which genetic alterations can be targeted. We can offer the best immunotherapy, and we can spare the ordeal of chemotherapy whenever that is possible. And that is the only way we can give our patients a long, meaningful, and good quality of life. Thank you.